Good evening, Dr. Kramer. This is my report on a conflict between a student and an instructor for NUR 4827. So the situation I decided to do was between a student and a professor. So Zach, a third grade nursing student, took an exam. Upon receiving his grade, he noticed that his score was 78%. The professor previously told him that he needed a minimum score of 80% on this exam to pass his class. The exam was to be reviewed next class. However, during the review, he noticed one question had two correct answers. It was overlooked somehow during grading. It happens all the time. After class, Zach decided to ask the professor and was again told there was only one correct answer listed, but if he could provide reasoning of the answer he believed to be correct, he would consider accepting the answer or tossing the question out. During my time in nursing school, this was a common occurrence, especially with pharmacology and med-surg. So conflicts between students and instructors happen every day. It could be something as simple as a disagreement on a particular subject or something more complex like challenging an exam question. Steps for conflict management. These steps all go hand in hand. So conflict resolutions, competing, cooperating and accommodating to the person, smoothing, avoiding, collaborating, and compromising as well. Resolutions, so these are the definitions for each. Compromising is when each party gives up something that it wants. Competing is when one party pursues what it wants at the expense of others. So basically one person wants something and they're being hard-headed and they're doing everything that they possibly can do to get it without thinking about the other person. It's very one-sided. Only one part typically wins. The competing party seeks to win regardless of what cost from others. Cooperating and accommodating is the opposite of competing. This is when one party sacrifices his or her beliefs and allows the other party to win. The actual problem is not solved and is usually a win-lose situation. So basically one person gives up while the other wins. Soothing is used to manage a conflict situation. It generally occurs when one party in a conflict attempts to pacify the other party or to focus on an agreement rather than differences. Avoiding, both parties are aware that there's a conflict, but they both choose not to acknowledge it or attempt to resolve it and basically walk away. So basically leave it there, and that can sometimes lead to negative patient outcomes. And collaborating, both parties set aside the original goal, and it's generally a win-win situation. So both parties generally work together in order to get what needs to be done completed in order to benefit either themselves or future students. So these were my examples for compromising. The professor giving the student a chance to challenge the question. Sometimes that doesn't always happen, so it's nice when a professor is open-minded and they allow you to come up with reasons as to why you think another answer is right over another one. Competing, the student raising the issue against the professor knowing it could be denied. So a lot of students generally won't challenge professors because they just don't like to stand up to professors knowing well that they could be denied or told or embarrassed in front of a class. Cooperating and accommodating. My example for this was the professor is giving the student a chance to correct a mistake that he or she could have overlooked while writing the test. Again, this is something that happens all the time and it's generally just a mistake. It gives the student a chance to pass the class by receiving a passing grade. So in this instance, Zach needs this one question in order to receive the grade that he needs in order to pass his semester. Smoothing, so instead of arguing with the student, the professor gave him a chance to provide an explanation for why there were two correct answers. So instead of trying to argue and rebuttal, he actually gave him a chance to say, hey, I understand your viewpoint, come back with me with backup from the book and explain to me why you think this is. The avoiding, it doesn't really apply here because the professor didn't really avoid the student. A lot of times professors will, if they don't know the answer to the question or if they need time to look it up themselves, they will generally say, hey, I need some time to look this up, or I don't know the answer, I'm going to have to get back to you. And generally, you don't really get an answer back unless you go back to the professor once more or several times over and ask, hey, did you actually find out what I was asking? But this doesn't apply here. Collaborating is when both parties have given up something that they want. So in this case, it was both of their time in order to further research or challenge the question that may have two possible answers. So for this one, it's a win-win situation for students who get the same question. So you can actually get the question pushed away or sent out of the future testing, or you can have the question rewritten with only one correct answer, or it can become a multiple choice or a select all. It's up to the professor's discretion. So for negotiation, before you go up to your professor, you definitely want to be prepared and know what you're talking about, especially when you're challenging them or challenging a test question. You don't want to go up to them and say, hey, I believe this is right, and not have any sort of information to back up your theory. So be prepared mentally by researching before asking the professor to challenge the question. Zach knows there is a second correct answer and is willing to challenge the question. He knows that if he can get the new answer accepted or the question thrown out, he can raise his grade and pass his class. So that's just generally a thought process and what you kind of want to think about before you raise your hand or you approach a professor or somebody in general saying, hey, I think there might be a mistake. So when asking to challenge the question, maintain composure and sound sure of yourself. Be assertive and direct. Zach was told there was only one correct answer, but if he can provide reasoning behind his thought process, the professor would accept the new answer. And generally, this is generally how it is. Even if the professor knows that there is only one correct answer, they will still tell the student, hey, if you can show me proof as to why you think this answer is correct, then I will change it for you. And then afterwards, you definitely want to ask the professor to restate the terms of the agreement. So if indeed you do find that the question did have two correct answers and you're able to back up that second answer, you want to make sure that the professor is going to make good with what he said originally, which is to either give your points back, adjust your grade, or throw out the question. And then afterwards, after everything has been taken care of, you definitely want to thank the professor for the opportunity of listening to you and thank them for your time, because you don't always get a professor that's open-minded like that, and a lot of the times they don't want to put forth the extra time in order to give you time to challenge the question and raise your grade. So some destructive techniques for resolving conflicts. So ridicule is one of them. I've seen this happen several times. So the goal is to intimidate others involved in negotiation. My example was if the professor decided to dismiss Zach and tell him that he was just a student once the issue of two correct answers was brought to attention. I've seen this personally happen to several students, and generally the professor goes into his office and asks the student to come into the office and kind of explains why there's only one correct answer, even though there might be two, and doesn't really give the student an opportunity to explain themselves. Flattery is when a person who has been flattered may be more reluctant to disagree when the other party is in negotiation, and thus his or her attention and focus are diverted. This does not apply to this situation. The professor definitely did not flirt with this student or compliment him in any way in order to get his opinion or mind of the question changed. And aggressiveness, this is when someone can be controlling of a negotiation before other members realize what is happening, and this can cause both parties to shut down and avoid the subject at hand. So delegation. Delegation of a task from a nurse to a nursing assistant was my example, and I've actually had this occur. This was one of my personal examples on the floor. This occurrence happened on a progressive care unit. The nurse asked a nursing assistant to clean up a patient. The patient stated that she had been waiting for 15 minutes when the task was delegated. After 10 minutes had passed, the nurse asked if the patient was okay and if they were cleaned up. The nursing assistant stated yes. When the nurse made rounds, it was found that the patient was still aggravated because they had not been attended to in a timely fashion, and the patient still had not been relieved and ended up soiling themselves in bed. Mind you, this patient was bedbound. After cleaning up the patient, the nurse confronted the nursing assistant and was found that they lied to the nurse and they were being deceptive in their charting. So in other words, they were charting that they were taking care of patients, providing pericare, changing sheets, and at the end of the day, they were not. So there's 5 rights of delegation. So you have the right task, right circumstance, right person, right direction, communication, and then the right level of supervision. And this is something that we've been going over since day 1 in nursing school. So upon delegating this task to the nursing assistant, the nurse made sure that it was appropriate. Delegating baths or asking a nursing assistant to please assist a patient to the restroom or bedside commode or bedpan, however they use it, is definitely appropriate. Since the nurse was busy with family members, it was delegated under the right circumstances to the right person. The nurse was a little bit wrong by not providing enough supervision. And this kind of happens and can happen on the floor on a daily basis because everybody is just so busy sometimes. The patient should not have waited over 30 minutes to use the restroom. If the nursing assistant was that busy, the task should have been delegated to another assistant, or the nurse should have stopped and completed the task. So that was something that the family members that I was speaking with could have been put on hold because it wasn't really an immediate conversation that needed to be had right then and there, and I should have stopped and went and helped the nursing assistant take care of this patient. Had I known she was that busy and was not able to take care of them, I would have definitely just done it myself because again, everything falls back on the nurse. So when delegating tasks, just keep in mind that you have to be smart. So this is an acronym that I've been using since I've started patient care. So make sure that anything that you delegate down is specific, measurable, attainable, relevant, and time specific. So if something needs to be done within a certain time frame, make sure that you vocalize that to that person so that they can get it done on time. And make sure it's attainable to them. So don't delegate blood work to a CNA and expect them to be able to get it done because they're not going to know what they're doing and it's not within their scope of practice. Delegation errors, so this happens again on the floor all the time without even sometimes being thought of. So a lot of, especially through management, a lot of management can under delegate, over delegate, and improper delegate as well. So examples of under delegating would be a lack of trust. So a lot of management would rather just do it themselves rather than to delegate it to certain nurses, whether it's their competency level or whether they're just too busy. And again, it's the responsibility. So a delegated task that a nurse is responsible for, regardless, I would just end up doing it myself and just making sure that it was done rather than giving it to somebody else. Over delegating, I've seen a lot of management do this as well because they have a lot on their plate. So they tend to pass off things that nursing staff and CNAs can do. So when this happens, a lot of the times it can overburden your staff. So if you have a nurse that's always a go-getter and they can't really say no to management, generally that manager will kind of always go to them as their go-to person to say, hey, can you do this for me? So it causes overburdens and that person can be overworked and it can cause nurse burnout very quickly. And then improper delegating is basically when management tells a nurse or one of their subordinates to do a task that is not within their scope of practice. So a good example of this one would be asking a nurse to fire another nurse if it's management. A nurse cannot fire another nurse, it has to be management. And then also improper delegating giving some